last one for the afternoon is the infamous Dr. Jim Cross, who I used to know when I used to work in emergency here. Jim graduated from the College of Medicine in 1973. He practiced emergency medicine in Saskatchewan and Arizona for over 30 years. He's a developer and co-presenter of the CMA Physician Management Institute leadership course entitled Management Dynamics, which you teach across Canada. Since 2008, he has served as a clinical assistant professor, College of Medicine, University of Saskatchewan. He's responsible for teaching emergency medicine tracked to rural family medicine residency program based in Prince Albert. Jim has been living at Emma Lake with his lovely wife, Marianne, and also a psychotic squirrel named Friendly. And aside from medicine, his day is spent patiently awaiting visits from his children and grandchildren. Dr. Cross, and his talk is entitled Summer Myths from the ER. Thank you, Jim.
Thank you. I am emceeing the banquet tomorrow night. There's a certain order of tables that go up to the buffet. I choose that order. So if you want to be first in line, clap heavily at the end of my lecture, or it may be 8 o'clock before you get there. I've tried bonding with animals. It hasn't worked. One of the unique things about Saskatchewan that's changed is we now have 7,500 moose living north or south of Prince Albert. We've always had moose in the north. Moose walking across the Trans-Canada. And you say, big deal, you don't want to hit a moose. Hitting a deer is one thing. You hit a moose, they come into the passenger compartment and cause a lot of death and morbidity. Anyway, I told my wife to hurry up and take the picture because it was getting cold lying on top of the truck. So first thing I want to talk about is anaphylaxis, because I have an interest in this. The incidence of anaphylaxis is increasing worldwide. Doctors do not like to give epinephrine. Doctors do everything possibly human to avoid epinephrine. Give the Benadryl, give the steroids, hold off on the epinephrine. Guess what the most common trait is in people who die from anaphylaxis? They either didn't get the epi or it was delayed. Give the damn epinephrine. Benadryl blocks histamine. Histamine is only one of the vasoactive solutions. Steroids have been shown to have no effect in anaphylaxis. Might help the biphasic part later on. Give the epinephrine. The 5 minutes is interesting. That is the average length of time from an iatrogenic procedure, such as starting an IV antibiotic, to death in someone who dies of anaphylaxis. So it's not like you can wait and say, let's just watch the patient because they'll get gradually worse. They don't. They'll go like this and then they'll crash and burn and it's too late. And I want you to notice on this slide how I'm politically correct in how I wrote the dose. What is correct about the way I wrote the dose? You're always supposed to put a 0 in front of a decimal point. You are never supposed to put a 0 behind a decimal point. No one's going to mistake that as giving 2 milligrams of epi because it's 0.2. Whereas if you write 2.0, that can be misinterpreted as 20. So know where your zeros go. For years and years, we gave epi subcutaneously. Patients seemed to do well. Suddenly, about 5 years ago, they said, no, give it IM because there's a better blood supply. I really don't care if you give it sub-Q or IM, just give it. And don't give it IV unless you're up to your asshole in alligators, because IV epi, in fact, does kill people. That is a completely different route with a completely different outcome. So be very, very careful. I'm going to do a quick census here. If you had an 82-year-old man who came in with urticaria, swelling of the lips, is on beta blockers and a nitro patch for angina, would you give him epi? Don't look at the bottom of the slide. The answer is yes. You are more likely to die from anaphylaxis than you are from an epi-induced acute MI. In fact, there's only been 6 cases reported in the world of an acute MI after epi. When you consider the thousands of doses that are given every day of this, it's an incredibly rare process. Freaky to be driving down a country road and look out the side and see a Malibu boat go by you at 70 miles an hour pulling somebody. We call this Darwinian triage in Saskatchewan. This man is doing the world a favor by removing himself from the genetic pool in the province. So what do you treat sunburns with? And I'm actually trying to focus on things that you're going to see at home. Not so much. Most of you probably don't work in Emerge. So what do you do to treat a sunburn at home? The good news is ibuprofen is still a drug of choice. There's over 20 NSAIDs on the market. Ibuprofen is the cheapest, it's the safest, and it's just as effective as any other NSAID that's out there, except if your patient has a cardiovascular history or has moderate or high risk factors. And if you can get the answer to this, I will buy you a drink tonight. Now, you don't know which bar I'm going to, but if you figure it out, I will buy you a drink. What is the NSAID of choice in somebody with moderate or high-risk cardiovascular disease? I'll tell you one thing, it's not ibuprofen. Anybody know which one it is? Naproxen. Very good. By the way, I'm at the Besbro tonight. And keep quiet, guys. Stay away from certain things. You would think that a topical antihistamine would be a good idea on a sunburn. In fact, topical antihistamines are sensitizing and have a high incidence of reactions. Spraying with benzocaine. If you do endoscopies, you know that once in a while you'll spray somebody with benzocaine and they'll develop methemoglobinemia, which you all remember from medical school, correct? These are people who suddenly turn cyanotic and you give them oxygen and they don't get better. So stay away from the cane, any cane preparation topically. Stay away from Benadryl and cold water. Some people use cold milk, seem to work just as well. This is why I gave up golfing. This is why you never want to cut your lawn when your children or grandchildren are outside playing. Apparently a 22-inch gas mower has a higher kinetic muzzle velocity and energy than a 357 Magnum. These things will whip out a fragment of metal faster than you can whistle Dixie. And the only reason I know what this is I read the caption underneath it. But if you know that that's the superior vena cava, you're a hell of a lot smarter than I am. And what that's showing is a little piece of metal that actually penetrated this young lad's chest and had partially gone through the superior vena cava and hadn't actually gone all the way through. And as you can see, this little guy required a thoracotomy to get this out. And I guess the moral of the story is if you're going to cut the grass, clear the yard. You don't want people watching. This is not the time for the grandkids to come up and show you something. Here's the other thing. And of course, in Saskatchewan, there's a big deal made of this every year. When the snow melts, the fire department goes out with their big heavy gloves on and picks up syringes. It's a sad fact of life. They're everywhere. And quite often you'll see somebody brought in to Emerge, and little Johnny's brought in by mom, and mom says, well, he just stepped on a needle down in Kinsman Park. What should we do? Well, here's the good news. All good news unless you happen to go barefoot in Barcelona, Spain. And they seem to have a particular problem in Barcelona. It's had the only recorded case of HIV from stepping on a community needle, and the only reported case of Hep C from stepping on a needle. HIV prophylaxis is not indicated, but many people will go ahead with the hepatitis B vaccination and the Hep B immune globulin. So we certainly talk people out of HIV prophylaxis because you're more likely to get in trouble from that drug cocktail than you ever are from getting HIV from this. This is one of the many slides I'm going to show you of the worst drug interaction known to mankind, which is alcohol and testosterone. I'm sure after a case of beer, this just seemed like a reasonable thing to do. This has been known for 20 years, that if you cut yourself, that the best way to clean it is under a tap with tap water. You don't have to use betadine, you don't have to use hydrogen peroxide. In fact, they probably cause more problems than they're worth. You don't have to get a special alcohol solution. Put it under a tap and wash it for 20 minutes. Now, probably won't work for a lacerated lip, but I'm saying anything else, this is still a great way to clean something, so you don't have to take any special events to make it happen. By the way, this was the world record that was set last year in Saskatchewan for combining, was it a hectare of land? I used to call it an acre, but they're hectares now. And I forget how many combines they had. I just thought it was a nifty picture. 249 combines. And how long did they do it in? It was under an hour, wasn't it? 7 minutes. Quite cool. Now, we get a lot of people coming in saying they were bit by a spider. Spider bites are very uncommon. And actually, most of these are MRSA infections. So methicillin-resistant Staph aureus. You can only call it a spider bite if you actually see the spider. And if it is a spider, you treat it no differently than you treat any other bite. You clean it. You tell them if it gets red or swollen or pussy to come back. There is nothing especially scary about spider bites. Unless they're 8 feet big, in which case you should be worried. Now, this is a very typical, I wanted to show this because I see this misdiagnosed fairly frequently. So this is a child who comes in, mom says he doesn't want to drink, he's got a sore mouth, low-grade fever. She says, you know, there's these funny little spots in his mouth. And you look in, and there's little ulcers on the tongue, over the gingival surface on the inside of the lip, and you think, herpetic gingival stomatitis, I'm a genius. And yes, it could be herpes. More likely to be caused by an enterovirus that causes hand, foot, and mouth disease. Now, I can tell you one thing about hand, foot, and mouth disease is every time I have said to a parent, this is hand, foot, and mouth disease, what has the parent said back to me? I thought only cows got this. You say, no, that's hoof and mouth disease. This is hand, foot, and mouth. Don't worry about it. It's going to go away. No issues. There's no treatment. What amazes me is how many parents don't notice these little vesicles on the hands and feet. So that's why if you see them in the mouth, you go looking on the hands and feet for it. This was my favorite cartoonist, Gary Larson. Says, you're kidding. I was struck twice by lightning too. This brings me to lightning. I used to practice at the Plains Health Center in Regina and Emerge, one of the nicest hospitals I ever worked in. One day somebody went in and shook some of the insulation, found a few asbestos fibers, so they shut it down as a hospital, which I thought was tragic. But a little neighbor of ours was out golfing and had his, his iron up in the air when he was hit by a bolt of lightning. Went down, was immediately in cardiac arrest. The Regina General Hospital Emergency Department was having its annual golf tournament. And a physician, Blaile Shane, who many of you probably know, who now practices out in BC, and 3 nurses saw him go down and ran up and started doing CPR. And I actually got a pulse back, and spent several days in ICU, and no sequelae except it blew out his tympanic membrane on one ear, and he needed a tympanoplasty done. And this is what's amazing about lightning is people usually in a cardiac arrest out of hospital, the survival rate is usually under 5%. These people do very well because they often get a return spontaneously of their pulse and often just have a respiratory arrest and need mouth-to-mouth ventilation. I thought this was cute. This was a Virginia Park Ranger was hit by lightning in seven different times. My advice to him was change religions. The other sort of tragic end was he had a fight with his girlfriend and committed suicide. And I think there's a moral to the story, but I'm not going to bother talking about it. The other thing you have to know is dilated pupils are very common after a lightning strike, so just ignore them. I Googled a tree because I wanted to put a picture of a tree in here, and there was about 1 million images that came up, and I didn't like any, so I drew one. No laughing, unless you want to be in the back of the line for supper tomorrow night. The record was set in England when 17 people were hit under one tree, 4 who went into a cardiac arrest. All 4 received CPR, all survived neurologically intact. That's why the current recommendation is, and this is very bizarre, is if you are in a lightning storm, you are not to go under a tree. Now, if you're in a forest, that's not an issue. But if you're sort of in a low area and there's one tree on the hill, don't go to that tree, even though that's logically what you would want to do. You're supposed to lay in the lowest area that's available. And this is from the Saskatchewan Star Phoenix, which never lies or exaggerates. You know how cows all stand in a row facing the same direction in a storm? Well, apparently they shouldn't do it next to a barbed wire fence because 14 of them suffered a cardiac arrest when lightning hit the fence and then traveled down. Apparently a hell of a barbecue that night at the farm. You just had to bring your own buns. Another example of the worst drug interaction known to mankind. We have a hot tub at the lake, but my wife won't let me drink beer in it. I can shoot things, but no beer. Does this patient require an antibiotic? So what you have is a folliculitis, macules, papules, some pustules, sparing the upper chest, the neck, and the face. Can have a low-grade temp, may feel a little bit achy. What is that? Pseudomonas folliculitis. Seen in people who sit in hot tubs. Apparently chlorine does not kill Pseudomonas. Does Pseudomonas like wet environments? Absolutely. Remember what we used to treat kids with cystic fibrosis in? We used to put them in mist tents and then wonder why they all got colonized with Pseudomonas. It's because the Pseudomonas was growing in the actual mist tent water reservoir. Doesn't require any treatment, goes away on its own in 4 to 6 weeks. I'm aware of one patient who was admitted on IV gentamicin for 3 weeks without any gent levels done, which is a little scary. I hope his hearing is good. One quick last one. 8-year-old in school, someone throws a stapler at him, bounces off his scalp, brought in to emerge, exams normal, kids asymptomatic. And you know, in a busy emerge or a busy office, you might look at that and say, oh hell, it's a bloody laceration on the scalp. No one's going to see the scar, so we'll just leave it alone. And what you see here is someone taking a Q-tip, opening up, and that's actually a fragment of bone. And if you look at the CT scan, you can see the fragment of bone with the arrow, and there's another fragment that's depressed. And the reason I'm showing this is because basic things are basic. all lacerations need to be explored. I would think that a lot of doctors would have looked at that scalp laceration and left it alone. I don't think that would have been a happy result because that is a compound fracture. I'm sure there would be an epidural abscess or something similar that's nasty there afterwards. So always remember your basics. If it's cut, look at it. There's plenty of room for all God's creatures right next to the mashed potatoes. That's a billboard from the Saskatchewan restaurant that's found in Greenville, South Carolina. And when they asked the owner, why did you call it Saskatoon, he thought it was a neat name. Thank you very much.